finally it is irreversible. It is irreversible one thing. If it is irreversible means we call it as ischemia or infraction condition. So primary T wave changes. So here we will note that secondary T wave changes, STT changes noted. Yes, because once conduction abnormality get conduction abnormality get treated, then ventricular conduction become normalized or depolarization become normalized. So we call it as secondary changes of STT changes. Noted.
Okay, let's say about the incomplete right bundle branch block. In incomplete right bundle branch block, QRS duration between 100 to 119 microseconds, same morphological pattern as complete RBB. It is commonly seen in young individuals, athletes, sometimes completely normal hearts. It is usually has no clinical significance unless associated with symptoms.
So well explained. Here the incomplete RBBB means it is common for normal persons also, including athlete or common adult. It is due to some morphological criteria. It will be a little more STT changes will be noted, not at all complete branch block.
Now we are getting into causes. In cardiac causes, we can observe ischemic heart disease, congenital heart disease, especially in ASD. Then we can observe in pulmonary causes, we can observe pulmonary embolism, pulmonary hypertension, chronic obstructive pulmonary disease. In degeneration causes, we can observe age-related degeneration, fibrosis of conduction system.
Mostly right heart abnormalities will prominent cause for right bundle branch block. Okay. And sometimes it may be due to TOF, congenital heart disease like TOF, ventricular hypertrophy and carpulmonale conditions also.
Okay, let's see the clinical significance of right bundle branch block. The clinical significance are incidental finding, marker of right heart strain, indicator of pulmonary embolism in acute settings. Unlike LBB and RBBB, does not usually mask STA elevation MI.
Okay.
Most patients do not require treatment unless associated with other conduction blocks.
Okay. So it is common and it does not needed any surgical interventions or primary interventions for initial RBBB. If it is associated with the complete heart block, let's plan about a pacemaker, either TPI or PPI, permanent pacemaker at all. Thank you.
Okay, let's get into the prognosis and management. Often benign, no specific treatment required, treat underlying causes, pacemaker rarely needed unless AV block develops. Okay, this is all about the right bundle branch block. Thank you.
So another block is about left bundle branch block. We'll see about what are the ECG criteria involving to identify the left bundle branch block and what are its causes and how it will be treated and underlying causes will be known. One more team batches are there. Will clearly explain about what does mean by LBBP. It is causes and it's how it is differentiated from another type of like RBBP at all.
So basically the left bundle branch block is a serious conduction abnormality in which the left bundle branch fails to conduct impulses properly. Since the left ventricle is the dominant pumping chamber, any delay in its depolarization significantly affects cardiac electrical patterns and often indicates structural heart diseases.
So here LBBP comparatively RBBP, LBBP is a most complicated disease because LV chamber is important one which is involving for systemic circulation. So if there is any conduction delay occurring in left bundle branches, will cause the hemodynamic assessment also because cardiac output get decreases, EF also get decreases. That is majorly noted one thing. RBBP is not at all important because will manage the pressure or underlying causes will get overload, pressure overloaded at all will normalize. But one thing affected LBBP in conduction abnormality. So we'll also suffering for more ejection fraction and systolic volumes also, preload, afterload, everything. Hemodynamic differentiations or hemodynamic affection will be noted here. So it is very important thing. We have to understand the underlying causes also, either primary or secondary changes in ventricular depolarization areas.